Good morning. On behalf of my Clinic 365 and Do Right by Privacy, we would like to welcome you to our webinar on GDPR. As data protection and cybersecurity have come to the fore in recent weeks, we thought it was worthwhile to carry out a quick refresher on our responsibilities as data controllers. Noel, who has many years working in the privacy space, will present a very quick overview. We will allow about 10 minutes at the end for Q&A. Please use the Q&A button to add any questions. I know time is precious, so with that, I will hand over to Noel. Over to you.
Thank you, Keith. Welcome, everybody. I'd like to go and refresh ourselves on our responsibilities as data controllers under GDPR. Before I get into that, I just would like to remind everybody that data privacy has been around quite a while. So we can go back to the Universal Declaration of Human Rights in 1948, the European Convention on Human Rights in 1950, which was ratified by countries including Ireland. In 1995, the EU issued its Data Protection Directive, and this was legally binding transposition of that into member states' laws of the EU, which included Ireland, who did that in 1998. So we've had privacy laws specifically here in Ireland since 1998. And the GDPR doesn't change that law that much. GDPR is not a completely brand new set of rules. It's just an evolution. The principles and so forth that were there prior to GDPR have not changed. Another topic, I suppose, under GDPR, everybody's scared of the level of fines that can be issued. 20 million euro or 4% of annual turnover. As they are the max, and we would expect large companies, global companies, may get fined something up to those levels at some stage. For smaller companies like yourselves, obviously that's highly unlikely. The level of fines would be appropriate to the size of your company. And even then, it would depend on the gravity of the infringement and whether, I suppose, if the infringement was intentional or negligent. And I suppose negligent is an important thing there. Did you do the appropriate things that you should have been doing? If you didn't, then you're more likely to get fined. Now let's look at some of these principles that are in the GDPR, but that were also in laws prior to GDPR, going back to 1998. So processing shall be lawful only if and to the extent that at least one of the following applies. We have a list there: consent, necessary for the performance of a contract, compliance with a legal obligation, protect the vital interests of the data subject. So you as a healthcare professional are likely to depend on some of these in your processing of data. Consent from your patients, yes. Compliance with a legal obligation, highly likely. Protecting the vital interests of the data subject, that's usually likely to be in a life or death situation. So yeah, lawfulness of your processing under Article 6, you can clearly establish as long as you have at least one of these. Conditions for consent. The controller, which is you, a healthcare professional, will be able to demonstrate that the data subject has consented. So you need actual situation. It needs to be in a form that the person agreeing to the consent absolutely fully understands what is going on. If you are getting this consent maybe online through your website or whatever, then the person with the right to withdraw his or her consent at any time. That needs to be as easy to withdraw as as to give consent. So if they tick a box to give consent to do something, then really to be able to withdraw that consent needs to be another tick box rather than something totally different. Processing of special categories of personal data. GDPR gives this a separate Article 9. Special categories of personal data is sensitive personal data, and health information is one of those. So obviously that's a huge part of your work, because you are processing this type of data probably all the time. GDPR says at the beginning that processing of this special categories of data shall be prohibited. So it's only allowing it to be done through one of these exceptions. First one there is the explicit consent. So yeah, so healthcare professionals would use that with patients quite a bit, but it's not just consent, it's explicit consent. So again, it must be absolutely 100% clear exactly what the patient is giving consent to. Other areas, the vital interests of the data subject comes up here again, and further on down, H, under medicine. So yeah, like all of you are I suppose, medical practices, and using that exception would be standard for you as well. Under GDPR, there are different roles. So on the left here, we've got controllers. So you would be the controller. Under GDPR, we have the data subjects, typically, obviously, your patients, but also people like maybe patients next of kin, if you are recording that information in your system. But don't forget, you as a business and as a practice, you also employ staff and have employees. So you're processing their personal data as well. So even if it is just HR and payroll and so forth. So you owe the same duty of care to your staff and employees as you do to your patients as data subjects. The processors you use, and that could be anybody from the person who helps you with your IT support, your web developer, if you have a website, things like Microsoft Outlook, maybe MyClinic 365 if you're using that platform, and many, many, many other possible processors. And then you have the supervisory authority in Ireland, the Irish DPC, Data Protection Commissioner. Just to remind you that the subjects, your patients, your employees have rights, and the GDPR has many articles from 12 to 23 talking about those rights. I suppose the one that may be impacting on you most is the right of access by the data subject. So subject access requests. So everybody has a right to submit a subject access request and find out what personal data you have about them. You really can't charge for that. Maybe previously you were able to, but you cannot now. And the data subject doesn't need to have a reason to request a subject access request. They have the right to get that information, full stop. They don't need to explain to you why they're asking you for it. They can just say, please give me my data, and you're obliged to do that. You're also obliged as a data controller to provide notice to your data subjects, to your patients, and even to your employees as well. What you provide, long list on the right-hand side there, I mean, it's pretty standard stuff. So if you have a website where you are gathering personal data, then you would need a privacy notice on that website, giving the data subject the information that the GDPR requires you to tell them. The privacy notice is just that, it's just a notice. So you don't get them to tick a box to say they agree with your privacy notice or they accept your privacy notice. If there's any place where you want to get their consent, that's separate and independent of the notice. The notice is just the information that you need to provide to your data subjects, full stop. No conditions around it, no nothing. Okay, so controllers, the GDPR talks a lot about controllers. Clearly, healthcare professionals like yourselves are controllers. For the purposes and means of the processing, the why, the how, and what data and so forth. Some of those you might think, well, how an IT system works and so forth. I don't know much about that. I leave that to my IT experts, my processor. But you still are responsible for that as the controller. Processors, the many different processors that you may use to help you to run your practice. If they're processing the personal data of your data subjects, then they're doing it on behalf of the controller. So there should be written instructions, so a signed contract, maybe including a data processing agreement. Sometimes your processor might provide you with a template agreement, like you would do if you were signing up to Microsoft or even with MyClinic 365. But sometimes you may need to write your own contract. Say, well, this is what I want my processor to do. And you have the list of specific written instructions within that contract that both parties sign. Engaging processors is, as I say there, vitally important because you are processing special categories of data. So the expectation under that heading is much higher. You need to ensure that your processor has appropriate technical and organizational measures to secure the data. So you need those yourself, as you see in a minute, but you also need to make sure that your processor has the same. Because of the nature of the data, you probably would need to be checking out that your processor has data protection knowledge, that they know about the GDPR, that they've put things in place within their company to ensure that they're following GDPR and that they're ensuring that they're facilitating their customers and clients like yourself with being in compliance with the GDPR. So I don't know, like getting a company that has a website that doesn't have a good privacy notice or a cookie banner might be an indication that these people mightn't have a good knowledge of GDPR. So I need to tread carefully here and possibly not use them as a processor. Contractual terms, there's a list there that really should be part of your contract with your processor. So you need to ensure that all of these are included. Responsibility of the controller. Yeah, many of those, but if you look there in the middle of that, appropriate technical and organizational measures within your organization. And that's vitally important because for the most part, for patient data, special categories of data, sensitive personal information. So you need to have appropriate technical and organizational measures in place. And you need to keep these under review, you need to keep them up to date. A couple of other things under GDPR that you need to be aware of and need to be doing under Article 30, you need a records of processing. So you need some sort of an inventory stating exactly what processing you're doing, how many different systems you have, what data you're processing, whose data, and so forth. Many small companies do this in a spreadsheet. Big companies, there are platforms out there that will help you to do that. But you need that list because the supervisory authority has the power to come knocking on your door. And by the way, can I have a look at your records of processing activity, please? The protection impact assessments is another topic that people wonder, well, do I need to do one of these or not? GDPR talks about DPIAs in detail. The European Data Protection Board has a guideline document on that, which is very, very useful. Within that document, as I know at the bottom there, talking about health area and hospitals and practices and so forth, the guidelines by the European Data Protection Board says, well, if you're a hospital processing patients' data, and you're going to need a DPIA for that. If you're an individual physician or other healthcare professional, then you're not likely to need a DPIA. So the gap in the middle, so if you're an individual physician, clearly you don't need a DPIA. If you're a large practice with God knows how many professionals working on it, you might reach a position where, yeah, maybe it would be a good thing to have a DPIA. What you would need to do is assess whether you need one and document your decision, whether it is to do one or not. Here, emphasizing the appropriate technical and organizational measures again. Article 32 says both controllers and processors shall provide appropriate technical and organizational. Technical might be around your IT system. Organizational are things like your policies and processes and procedures that you have within your practice, telling your staff, in effect, how to do things. So you need that kind of documentation in place. Again, kind of looking at security, when you are talking to your IT people, whether those people are within your organization or you're using an external kind of processor for that, make sure you understand the technology that you're talking about, things like encryption, antivirus, and so forth, the list on the left there. You need to be familiar as a controller with what's going on there and understand the terminology and understand what is needed, what's not needed, and the level that it needs to be at. Also, don't forget your physical environment. You have a physical office surgery where your patients come and so forth. So you need to control that so that paper, computer screens and so forth don't get to be seen by people that, don't need to be seeing that kind of information. So you might have CCTV, you certainly would have locks and keys and entry systems into different rooms. You may have a clean desk policy in your back office, so that's, the place isn't just covered with papers all over the place. I'm just going to show a couple of slides. So in terms of data breaches, and these are happening all the time, everywhere. Big companies have them, small companies have them. It is just part of life. Analysis on that shows that like half of data breaches worldwide are malicious attack, and we saw what happened to the HSE recently. So half malicious attack, and don't think that you're exempt from that because you're a little practice in rural Ireland. Everybody, it's possible that the hacks from Germany or not Germany, from Russia and so forth, will target small little practices as much as they will things like the HSE. And so the interesting thing here is that just about a quarter of breaches are as a result of human error. Plain and simple, somebody making a mistake, and we all make mistakes. I made plenty of them, we all do. So a quarter of all data breaches are as a result of somebody making a little mistake. And then the other quarter are system glitches. So software that you use, inevitably every now and then there will be a bug or a mistake or something that will cause something to happen that results in a data breach. Here are some examples from the Irish DPC. The Tusla Child and Family Agency last year had 3 decisions against them that you probably all are well familiar with. And again, these are examples of human error. So somebody within Tusla gave out information which they shouldn't have. So maybe there was an issue with the policies and procedures within there, and the DPC said, is to implement appropriate technical and organizational measures. So there would have been the organizational measures. The HSE also fell foul of the DPC last year, and where paper files were found at a public recycling centre. their process for deleting paper files obviously was not very good when they ended up in a recycling centre. In the UK, there are many examples. They're reviewed specifically to do with GP surgeries, where the first one, somebody, a secretary within the surgery, reading medical records of patients, and that person was looking up their own family records and neighbours and relatives and so forth. And that was wrong. That was a breach, and he got fined and the practice got fined. So who has access to what is obviously clearly an important area as well. Okay, that's the different topics that I wanted to cover today. Obviously, kind of where we went rushed through, but hopefully you picked up some little gems there that might help you in you trying to keep on the right side of the GDPR.
Thanks, Noel. That was fantastic, and I believe it was very worthwhile for the people on. There's a few questions coming in there. I suppose the first question is it possible to get a clear answer on the guidelines for patient communication by email and text, including releasing copy of results to patients? So if you could go through that, Noel.
Yeah, I mean, I suppose communicating with patients, like I suppose traditionally and normally it would be face to face. We as patients go to see our practitioner and sit opposite the desk and get results of tests and so forth. But now more and more technology is being used. When using technology, I suppose we just have to be totally mindful. We may be dealing with and are likely to be dealing with special categories of data, health results, test results, and so forth. But there's nothing to stop you from using things like email and SMS. But because of the nature of the data, if you are using emails, those emails would need to be encrypted. So that if the email did fall into the wrong hands, then at least they would not be able to access the data. When using email, I suppose there is a huge warning because so many breaches are as a result of poor email etiquette, for the want of a better word. So, you know, you're sending an email to somebody, Outlook picks up, when you start keying in the recipient name, it picks up the name for you. And if it picks up the wrong name, so it's Mary something rather than Mary something else, you could end up sending the email to the wrong person. And that would be a data breach where you would be obliged to notify the TPC. So if you are using email or SMSs, you need to clearly have your procedure as to how people do that. People need to be trained. Use of BCC probably comes into it, but being so careful to ensure that you are sending the right email to the right person is critical. Encryption would be vital here. Just using normal email would not be providing appropriate technical and organizational measures. You would be failing on that front. So yeah, it's possible, but make sure you have the appropriate technical and organizational measures when you are doing it.
Thanks all. Very good. The next question, there's a question here actually, it's quite an interesting one. I kind of came into my own mind as well when I was listening to you. You consent, and particularly the consent of next of kin to store their details.
So if a patient is providing details of their next of kin to their GP or to their practice, I suppose the patient would need to let the next of kin know that they are next of kin, and to let them know what information about them they are giving to the practice, i.e., yeah, your name, phone number, presumably, maybe name, address, phone number, maybe email address. But the next of kin knows clearly that this personal data belonging to me is being given to the GP practice.
Okay. So there's nothing in particular that the practices need to do from consent wise for next of kin.
Well, I suppose when they're getting it from the patient, maybe just checking, yeah, and at the next of kin knows that that their names have been given to the practice. Obviously, it's a family member, so it's somebody's parents or somebody's children or something like that. If it's a totally like outside a family person, then they might need to raise a question or ask a question about that.
Perfect. Thanks. So there's another one here. So you've mentioned DPIAs, but we also been mentioned the data sharing agreements are required with our processors. When is a data sharing agreement needed?
Yeah, you and I have talked about data sharing agreements in the past, and there seems to be a little bit of confusion. Like if you're the controller and you're using a processor, then the agreement between you would not be a data sharing agreement. You would have a contract between the controller and the processor, where the controller is telling the processor what to do on behalf of the controller. Data sharing agreements more likely come where two controllers are interacting. So you as a controller are passing data to another entity that is also a controller in its own right. And then maybe a data sharing agreement would be appropriate in that scenario. I don't know, an example of that might be your practice and your staff sign up to a private pension scheme that your organization is running. So certain information would need to get passed from you as the employer to the pension company. But the pension company would have its own relationship with your employees, and that would be totally separate from yours with your employees. But you would be passing some information, maybe around what you pay in payroll, monthly payroll, and so forth. So in that scenario, a data sharing agreement probably would be appropriate between the two controllers.
Okay, great. Thanks a lot. Look, that's all the questions for now. If anybody has any further questions going forward, you can email us at support@myclinic365 with those questions, and we'll endeavour to get them answered for you. Otherwise, look, thanks for taking the time this morning, and thank you, Noel, for taking the time to go through that. It was very enlightening, I think, for all the practices. So thanks again, and hopefully you'll be joining us for one of our future webinars going forward. Okay, thanks very much.
Thank you, Keith. Thank you. Bye.
Bye-bye. Thanks, Noel. Bye-bye. Thanks, everybody.